While the world's focused on vaccines against COVID, a breakthrough's been made in fighting another disease. The WHO has approved a malaria jab. So can it help wipe out one of the biggest killers of children in Africa? And will it be affordable for those who need it the most? This is Inside Story. Hello and welcome to Inside Story. I'm Kamahl Santamaria. It kills more than 400,000 people a year out of an estimated 229 million cases. And now there's a vaccine for it. And for once, we are not talking about COVID-19. It is, in fact, a malaria vaccine. And the World Health Organization is recommending it go into widespread use among children in Africa. Now, obviously, there is a lot of optimism about this. But as we'll discuss shortly, there's still a lot of work left to do, most notably funding and the political will to make that happen. We'll introduce you to our panel in a moment. First, this report from Victoria Gatenby.
It's being described as a game changer for child health, a vaccine that could help save the lives of hundreds of thousands of children each year in sub-Saharan Africa.
Malaria has been with us for millennia, and the dream of a malaria vaccine has been a long-held but unattainable dream. Today, the RTSS malaria vaccine, more than 30 years in the making, changes the course of public health history.
The GlaxoSmithKline vaccine has been given to infants in Ghana, Kenya and Malawi since 2019 as part of a pilot programme. It was found to be about 30% effective at preventing severe cases of the disease, which is transmitted through mosquitoes. But that figure rose to around 70% when the vaccine was combined with other treatments.
I think eradication is still quite some time away, but I think the combination of bed nets, chemoprophylaxis, and this vaccine and another vaccine, maybe other vaccines in the future, will bring malaria burden of disease down substantially in Africa.
Malaria causes fever, vomiting and fatigue and kills more than 400,000 people each year, mostly children under 5 as well as pregnant women. The RTSS vaccine, also known as Mosquirix, has been welcomed by researchers as an historic breakthrough. But many on the continent worry about funding and whether a mass rollout will be possible in the wake of COVID-19 and other competing priorities.
With malaria being a disease of especially by and large, a disease for sub-Saharan African children. And given the difficulties that our countries are facing, we hope that the international community is going to stand up and make this vaccine available to the children who need it.
The World Health Organization recommends giving the vaccine to babies in 3 phases, followed by a booster shot, but that may take time. The next step is for the Global Vaccine Alliance, known as Gavi, to look at whether the vaccine is a worthwhile investment. If it's approved, Gavi will buy it for countries that request it, a process that is expected to take at least a year. Victoria Gatenby, Al Jazeera.
So let's bring in our guests. And do we have a doctor in the house? Yeah, we've got 3 of them, in fact, all in Africa as well. First of all, in Abuja, Nigeria, Akpaka Kalu, who's the regional advisor for tropical and vector-borne diseases at the World Health Organization African region. In Johannesburg, South Africa, Helen Rees, a board member at Gavi, which you heard about in that report, the Global Alliance for Vaccines and Immunization. And in Nairobi, Kenya, Abdhalah Ziraba, an epidemiologist and research scientist at the African Population and Health Research Centre. Doctors, welcome to you all. I feel we are in very good hands today. Dr. Akpaka, let me start with you in Abuja. 39% of malaria cases prevented by this vaccine, and it goes up to 70% when it's combined with the anti-malaria drugs. Are you good with that, 39%? It doesn't sound, I mean, in fact, I think the WHO says it needs an efficacy rate of 50% at least for approval. So are these numbers all right?
We believe that every life saved from malaria is worth the investment. At 39%, when combined with seasonal malaria prophylaxis going up to 70%, is acceptable. We realize that malaria control depends on an armament, a toolkit that is full of imperfect tools. And this is what we are advancing. As technology delivers more tools, we'll keep improving. So we welcome the approval to scale up RTSS vaccine all over Africa, because that life that is saved is a life worth saving.
Certainly is. Dr. Helen Rees, let me get your initial thoughts as well on those numbers. Again, just explaining to our viewers the combination of the vaccine and the anti-malaria drugs. Do those numbers stack up to you? Are they acceptable?
Well, they certainly do. One of the reasons is that we need more tools to tackle malaria. You've heard the figures. In the African region, we estimate that we're losing about 260,000 children every year from this. But more than that, these repeated attacks that often occur in childhood really affects childhood development as well. So it's not just the deaths that we definitely want to reduce. It's severe disease, it's hospitalization, and it's the chronic effect as well. So just bear in mind that if we combine, a 70% reduction in severe disease is huge. It's a massive step forward, because we kind of plateaued with all the tools that we've got in terms of being able to now reduce malarial case numbers.
Okay.
So we needed more tools, and this is one of them.
Okay, so let's build on the idea of that plateauing with Dr. Abdhalah Ziraba in Nairobi. Dr. Helen says there has been a plateauing of that, and also I would note there's 6 years, I think it is, of tests and trials that have been going on this vaccine, and actually years before that as well, as part of the whole development. Is that normal to be taking that long? I sometimes wonder if my COVID brain thinks that things should be happening a lot faster now because of what we've been talking about in the last 18 months.
Yeah, thank you. I think unknown to a lot of people who are not close to malaria programming and research are not aware that the search for malaria vaccine has been raging on for the last 30 years, like the W.H.O executive director mentioned. So the 6 years you're alluding to is something that vaccine development has been accustomed to. Right now, we still don't have an HIV vaccine, and attempts are still being made. So it's not really unexpected or unheard of, but we are happy that we've gotten something that we can consider to be relatively effective when combined with other existing interventions.
Can you say what has proved so elusive in these 30 years? I know these are long-term projects, obviously, but has there been something which has been constantly, proving to be a hurdle?
Yeah, the malaria-causing organism, that is the Plasmodium, is a very tricky organism. It's a protozoa that has different stages. It can hide in different parts of the body, the liver, the blood, and it has a vector phase. So as opposed to other organisms like viruses that enter your body and they can be tracked probably in one area, this protozoa is actually a very elusive disease-causing germ. And we talk about antigenicity, that is variable, meaning that if you target a certain antigen, probably in a few years' time, that won't be effective or that won't work. So the problem has been around how do we target the antigens, those antigens that can be used to induce immunity and therefore fight disease when one is exposed to infection. Okay,
then. Dr. Akpaka Kalu in Abuja, let me come back to you. Tell me about the trials, the places where it's happened, the number of people involved. There was even some controversy as well. The British Medical Journal was saying last year that they said the WHO was only using implied consent. It wasn't actually getting explicit consent from parents for these trials. How has it all gone?
Well, the first thing to note was that the piloting of the vaccines in Ghana, in Kenya, and in Malawi was piloted through the national immunization system. The piloting was not a trial per se. Trials have been conducted and vaccine proved efficacious.
What's the difference between a pilot and a trial then?
Yes, the piloting was to look at the feasibility of using existing routine immunization mechanism to deliver this vaccine and looking at the impact of it, positive or negative, on that system. And the result is that the vaccines can be delivered through the immunization system in countries, and it has no negative impact in the system, neither did it disrupt any existing delivery of vaccines. So having proven that and knowing that the vaccine is efficacious, W.H.O, the joint meeting yesterday of SAGE and Malaria Policy Advisory Group approved the wide-scale use of this vaccine. And that's why we are excited that it can be delivered through a routine system, not another vertical system, not a campaign per se, but routine immunization system. And we find that the vaccine itself, is a brand on its own because people know malaria and its deleterious effect to development and to children and to adults. And therefore, we found that people on their own go for the vaccine without much investments in massive communication that is outside the routine system. So we are excited that as vaccines become available, countries will adopt the vaccines and deliver it to those children and save the children, not just from death, those who survive, hopefully from the chronic impact of malaria on development of the children, on stunting, on intellectual performance in schools.
Right, so you talk about it being picked up and moving forward and actually getting to the people, and that's why I'm really glad we've got Helen Rees with us today, who's on the board of Gavi, the Vaccine Alliance. From what I've been reading today, it now comes to Gavi, which has to decide, and I think it's December they're expecting to decide about whether this is viable, whether this can be picked up and moved forward. Is there any question that it won't be?
Well, I don't want to preempt a board discussion, but what I certainly can share with you is that the Gavi board has been, this won't be the first time the Gavi board will have discussed the malarial vaccine, has been following the development of the vaccine very, very closely. Gavi as an alliance, the aim of Gavi is to support the world's least well-resourced countries in purchasing vaccines, in strengthening their health systems to deliver vaccines, and in helping countries have all of the bells and whistles that are required to deliver vaccines, call it. So Gavi has had a huge impact and saved millions and millions of lives as an alliance through that kind of support to the delivery of many, many different, particularly childhood vaccines. So this kind of thing, which is looking at a disease which has really got stuck, but is affecting so many children in some of the poorest countries of the world, is the kind of thing that Gavi would certainly want to prioritize. But obviously in doing that, we'll be talking with the donors who support Gavi to say, how much money have we got? Is there a window? Can we do this? Gavi also depends on WHO's recommendations. So yesterday's announcement by WHO is a very important milestone in the sort of process towards Gavi decision making. But as I say, something like this would certainly fall into, theoretically would fall into a Gavi portfolio because their aim is to save lives, and particularly in the poorest countries.
At the risk of oversimplifying, and you did allude to it though, it'll come down to money, won't it? In fact, Kate O'Brien, who is the head of the WHO's Department of Immunisation, said, as we've seen from the COVID vaccine, where there is political will, there is funding available to ensure vaccines are scaled to the level they are needed. That's what it is in the end, isn't it? Political will, someone willing to stump up and say, yes, we have to do this.
Absolutely. One thing I would just comment on, though, is on the Gavi board itself, there are a number of health ministers, including ministers from several of the sub-Saharan African countries, Ghana, Ethiopia, where this is a problem, and they have expressed extremely strong views about the importance of tackling malaria. So I think it's very likely you'd get huge political support from the leadership of countries that have a high burden of malarial disease. But the support we also need is the philanthropic organizations, the bilateral donors, the richer countries to come in with the money. And we recognize that we're asking people also to come in with funds for COVID vaccines at the same time. So we recognize that there is going to be, that we're going to have to push very hard to get these funds. But certainly in principle, the donors that I've spoken to and I've heard speaking would be in principle very supportive of this. But it's how much money is in the bank at the end of the day. You're quite right.
Yeah, always is, isn't it? Abdhalah Ziraba in Nairobi. I know that the COVID-19 vaccine rollout is a very different beast, and it's a very different situation. But what I would point out is that the rollout of that vaccine across Africa has been incredibly poor. I think we all know that, we can all see that. Does that concern you when you think about, whenever it is, wanting to roll out a malaria vaccine to those who need it the most? Lessons need to be learned?
Yeah, there are definitely serious concerns around commitment from governments and funders to put money on the table to secure the vaccines. But probably that is becoming a bigger problem because of the current problem that we have. Resources are being used for COVID and other priorities, reviving the economies and all that. So the timing is not really the best. If this happened in 2019, probably the expectations will be different. But having said that, I think I agree. I agree that the appetite, the motivation to address malaria as a public health issue is very, very well received around the world. So if you're doing anything on children, whether you're UNICEF, whether you're some other organization that's addressing the health of children, you definitely need to be part of this. So there is no way people are going to look the other way when we have something that promises to address one of the biggest killers of children on the continent.
Akpaka, Kalu, can I get your thoughts on the same?
I'm quite optimistic.
Well, good to hear. Akpaka, Kalu, can I get your thoughts on the same issue, the idea of making sure, once the money is there, once the vaccines are there, actually making sure it gets to the people? Because that's the sharp end of all of this, pardon the pun. This is the most important thing, actually getting it into the arms of people when the time comes. And the COVID situation, certainly in Africa, has shown us that that can be problematic.
Certainly, that's very important, and that is part of the things that are looked at in the ongoing pilot in 3 countries. We find that the malaria vaccine is being delivered at the same level as the DPT vaccine, or even exceeding in some countries. So we see that people value malaria vaccine, people value anything that will prevent malaria. Malaria doesn't need advertisement because people at the local level know malaria. Therefore, we are optimistic that with vaccines available, with countries adopting to deliver the vaccines, that there wouldn't be much challenges other than what is routine. So we are excited, we are optimistic that this tool will get out there and that lives will be saved.
Folks, let's look at the measures as a whole, because yes, a vaccine is one part of it. And as we've mentioned, there will be anti-malaria drugs, which are part of it as well. And then I've done a lot of reading today about mosquito nets and how incredibly important they are. Dr. Akpaka, a quick thought from you, first of all, about, well, actually, maybe you can just explain to our viewers how important and what a sort of tool these nets are in the fight against malaria.
Insecticide-treated nets, like the name implies, are mosquito nets impregnated with insecticides. When delivered and used appropriately, they knock out the mosquito. They prevent malaria. So these are very effective tools. But in malaria, we do not have any perfect tool. Even the net is imperfect. During trials, it's barely got to under 50% efficacy. So what we are saying is that we are not replacing the nets. We are not replacing other interventions with malaria vaccine. We are adding an additional tool to the armamentarium. Let's use all of them where applicable, and let's keep moving forward, controlling malaria, eliminating malaria.
Helen, Rees, am I missing anything there? Are there any other arrows in the quiver when we want to fight malaria?
Well, I think one of the things that this sort of raises again, we're talking clearly about prevention, which is critically important. It's always the first tool for any infectious disease. But I think the other thing we should also think about is treatment. Because in many of these endemic areas, or where they've got seasonal malaria, being able to get children into facilities with the facilities able to rapidly diagnose and treat is also extremely important. The same is true for COVID. So as we think about the continuum of how you tackle a problem, one very important issue is to strengthen health services, to train healthcare workers continuously so they're able to diagnose malaria, and to give them the tools to be able to quickly treat malaria cases. Because, as we said, this isn't, even with all these tools together, these are not the 100% prevention tools. So we will continue to see malaria in these high-burden districts.
Dr. Abdhalah, do you agree with that there needs to be more work done on the treatment side of things and making sure everyone's up to speed? Education, effectively, as well.
100%. I agree that all the existing interventions need to be sustained and probably even ramped up to sort of have a combo that will probably knock out more malaria transmission events. And probably I can add the issue around behavior and the interventions that I've just talked about. If you were to use a bed net, your behavior has a lot to do with how effective that bed net will be. If you're going to take malaria tablets, it depends on how compliant that particular person is going to be able to take that medicine. And that is really a challenge for all those interventions that have been in use before. So if we have an additional intervention like the vaccine, where if it's put in your arm, probably there's no way you can get it out, and the only hope and prayer is it elicits the effect that we desire. So that's the reason why we're saying it's a game changer, because it's going to be really complementary, additional, and probably supportive of the existing interventions. And from the pilots, one of the things that have come out is that at least from that environment, we've not seen any negative impact on existing interventions. Probably that might happen later, where people think they've gotten a jab and therefore they are safe. They abandon the existing interventions, but I think that would be the wrong thing to do. And probably the programming should be aware of that and make sure it's a priority messaging issue, and sustained availability of treatment, sustained availability of nets, because we know these interventions have, even when they're being provided free of charge, they have hidden costs. For example, the distribution of nets in hard-to-reach areas. How do we trust the people who are involved in the distribution to reach the remotest village in the district? So if these things continue working together, I think we might end up with better results compared to what has been happening.
Right. We're running out of time here, and I just want to ask one more question, and permission, if you don't mind, to ask a rather simple question. What about going after the mosquitoes themselves? Obviously, the nets help protect from mosquitoes, but is there any way, and maybe Dr. Akpaka, I'll ask you, of targeting the mosquitoes in the first place, if that's where the malaria comes from?
Actually, since we documented the plateauing, the stalling of the dynamics of reducing malaria burden in Africa, we started more and more looking at what can we do differently. One of the things to do differently is to mainstream multi-sectoral approach to malaria, meaning involve the non-traditional partners, the agricultural sector, the road sector, the construction sector, the environmental sector, all these sectors whose core businesses contribute to mosquito breeding. Let us sit down with them and see what they can do to ameliorate the unintended effect of their work on malaria transmission. So yes, we could, but based on existing technologies, the best is to bring in the stakeholders together and then work with the communities to see how we work together to ensure that if there's an irrigation project, the irrigation project does not lead to increasing breeding size or malaria epidemics. If there is open mining going on, the open mining does not result in breeding size that will lead to increased malaria transmission. So these are things we are looking at. We hope that by the first quarter of next year, we'll bring together the 47 malaria endemic countries with the non-health ministries who have a role to play in malaria to look at multi-sectoral response to malaria. We know a few countries are already looking at that. So that's the direction to go. But exactly what we do will depend on available tools.
Doctors Akpaka, Kalu, Helen, Rees, Abdhalah, Ziraba, thank you so much for your time today. We've all really learnt a lot from this discussion. Thank you. And as ever, thank you for watching as well. Remember, we're online at aljazeera.com, including in the podcast section where you can now listen to our discussions whenever you'd like. Also plenty of discussion at facebook.com/AJ Inside Story. On Twitter, we are at AJ Inside Story and at Kamahl AJE if you want to drop me a line directly. I'm Kamahl Santamaria on behalf of the Inside Story team. Thanks for watching. We'll see you again soon.